Hey, driver, it's always great to have on board Dr. Fahmi Farah. And you being a cardiologist, of course, when you need medical attention, you need somebody to be there for you. How do you look at this? I'm sure that you are great, of course, being your own advocate out there, but is it important for somebody to have somebody in their corner that can speak for them, somebody to speak for you in a case maybe where you're medically not able to do so? How important is it to have an advocate?
I think it's extremely important to have an advocate because a lot of times, things are difficult. Like, sometimes if a patient is in the hospital and they're not quite understanding, a sick person sometimes can be confused too. And those are the times when an advocate who really knows what your wishes are, what your medical wishes are, can communicate for you and also can speak on your behalf. So I think it is important.
Okay, absolutely. And that advocate can also be there to take it to the next level when it comes to treatment, correct in that? Because say that somebody maybe suffers a situation involving a heart blockage, that I would imagine maybe there could be recommendations for aerobic exercise, jogging, swimming, biking, maybe some moderate weight lifting that somebody might be assigned to do out there. But can an advocate be that coach for that individual, giving that person that's experiencing a medical condition that nudge, not to give up and to get back into the game? How important is that?
It's extremely important. You brought up a very, very valid and important point. Yes, having that companion or that advocate who can encourage you to eat healthy, remind you to take your medications, to keep your doctor's visits, and absolutely exercise. Like a lot of times when we're just exercising on our own, we may not have that motivation to carry out these duties, especially a lot of people who live alone. To have that advocate, whether it is a significant other or a friend or a relative, I think it goes a long way.
Okay, and when you are setting a treatment plan for somebody that maybe has got a heart blockage, as an example, I know cases may vary, but do you look at things like maybe combining different forms of exercise after somebody is undergoing heart treatment for a blockage, like walking or weightlifting? Is that a first step?
It is. Walking, after a heart attack, if somebody has a heart attack, for example, we often enroll them into a physical therapy program that's called cardiac rehabilitation, that's basically monitored exercise to get that person up and going. And so to have somebody, in case of a blockage, not necessarily heart attack, that person who can help them to do those types of exercises would be tremendously beneficial for that patient.
Okay, absolutely. And if, say, somebody, doctor, has got a diagnosis of a heart failure, does that normally get progressively worse over time, but can certain cases, can it be reversed with treatment? Does that help?
Yes. So congestive heart failure, there are many forms, many different causes that can lead to heart failure, but for the most part, if it's caught on time and if the proper, appropriate, timely treatment is provided, then many, many times we can reverse it completely. And of course, that means doing certain procedures, medications, heart-healthy diet, exercise. It's a whole, inclusive approach. It's not just one thing. And when it comes to that, compliance from medication from the patient side is very important, not just with medication, but following up with their doctor's recommendations on everything. So yes, a lot of the times congestive heart failure is reversible. Sometimes it's not.
Okay, very good. And from the other side of that, when you are maybe prescribing, say, a prescription regimen or maybe an exercise therapy to help somebody get back on their feet, so to speak, do you also inform the advocate as to what the medication regimen would be? Maybe a spouse as an example, or maybe, say, an adult child. How important is it to have them also involved in this process for discussion?
Very important. In fact, a majority of the times, some of my elderly patients, especially when it comes to males, there's something about that. It's usually the wives who are in charge of their medications. So a lot of times the male patients, they come in and they don't even know what meds they're taking. They'll have to call their wife, who usually knows exactly what they're taking, and they're the ones who are managing their medications, and the patient just takes what he's told to take. So that happens frequently. And so, yes, I do think having that person who's managing medication, like that extra set of eyes and hands, is very, very helpful when it comes to compliance with medications.
I would imagine over the years, doctor, that you've probably seen a lot of male patients say, well, I'm not going to the doctor, nothing wrong with me. Do you find that maybe stubbornness can be a big factor in somebody saying, somebody needing medical attention? In other words, I'm just not going. Do you find that quite a bit?
We do, and that's when the family member and that advocate becomes so important, their role, because they're the ones who can actually encourage them to, first of all, go check it out, what's going on with their health, see a doctor, get the appropriate testing done, and then actually following through with the recommendations. So, I think the role an advocate can play is huge in a person's well-being.
All right, very good. And now, the other side of that, we know that men can be stubborn. I'm speaking from experience. But can women be equally as stubborn, stating, I'm not going to the doctor, nothing wrong with me? And is it maybe the children or the husband that kind of nudges them in that direction to go in?
In my experience, what I typically see with women is not that they're stubborn, that they don't want to come to the doctor. Often what I find is they don't have the time to come to the doctor, because I hear this a lot from my female patients, is that, I have to take care of so many people. Like, they're usually the ones who are taking care of the children, the husband. They just take on a lot on their shoulders, and many women are also working. They have a career. So what I've seen is, like, they usually tend to neglect their own health. They prioritize others and other things above their own health, and that's where they fall short. And that's why part of the reason our statistics when it comes to death related to cardiovascular disease in women is so high is partly this. I will add to this comment, is that a lot of times we see delayed care when it comes to females, even in the setting of acute heart attack. We see that quite frequently, and it's because of this reason, partly.
Okay. Are most general practitioners, doctor, able to recognize what is going on with, say, a heart attack or coronary artery disease? I'm sure there's so many out there that are, but could the whole medical field maybe need more training to recognize these things?
I believe so. I think training is always, warranted across the board, like education for our primary providers, and first contact, like ER, emergency department patients, to recognize these things. But also, like, patients themselves, our community, to recognize when to go see a doctor, when to seek help. I think those are important educational points, and recognizing those is important.
All right, very good, doctor. Let's do this. Got to do the break. So I'm going to put you on hold, and drivers, call us. Let me get you on board. 888-876-2336. All right, let me ask you this. Ladies and gentlemen, people being people, when you are, say, on the road, you're driving down the road, you got something medically going on, you just don't feel well, something's going on, do you call your family just to let them know what is going on, or you just kind of say, well, I'm just going to let it go, or just trying to kind of chalk it up to old age? Do you keep your family informed as to what's going on? Maybe not every cut of the finger, but if there's something that does require an intense medical intervention, do you speak up? Or is it a situation where you say, well, I'm just kind of let it go, I'm a tough guy or a tough gal, I'm able to handle this on my own? Want to hear from you about that. Let's talk about the importance of family when we come back in a minute. SiriusXM 146. Hey, drivers. Yeah, I want to welcome you back. And always great to have on board Dr. Fahmi Farah, one of North America's leading cardiologists. And, it's a very important subject matter. You got to know what's going on with your body. If it's telling you something, you don't want to ignore it. Aches and pains, don't chalk it up to old age. Don't chalk it up to young age. Just chalk it up and get checked. That's what it's all about. And, Doctor, thank you again very much for joining on the show. Now, you and I are both in the Dallas-Fort Worth area, and a local news personality, Hal J., who works for radio station WBAP, he underwent a heart transplant, and he's doing good. So that's good news right there. But when you mention heart transplant, I would imagine that is kind of like, my golly, that is just overwhelming when you say somebody needs a heart transplant. What is that? What goes on there? How does that work?
Yeah, so heart transplant is usually warranted when somebody has severe heart failure. So the heart is no longer working, and without a transplant, that person would not have very long to survive. I've actually placed, a couple of my patients on the transplant list. Heart transplant is, of course, a very, very intense process. So just to give you a roadmap of how people can get there is actually one of the ways people can get there is heart attack. If somebody has extensive blockages in their heart and, that's not taken care of, that blockage burden can cause the heart pump to weaken over time, and the heart can go into heart failure. And if they have a heart attack, of course, that can build scar tissue in the heart muscle, and so that part of the heart just basically dies, and so the heart can go into heart failure. And, of course, if it doesn't recover over time, then that patient would be eligible for a heart transplant. There are many, many factors that's taken into consideration before a patient can be put into a transplant list.
Okay, very good. And this transplant list, is this a national registry? Is it local, state? What's that list about?
It is usually a national registry. It's very difficult, actually, to get a heart transplant. Just to give you an idea, annually we have roughly 5,000 hearts available for transplant, and the list has thousands of people on it. So it's not that easy to get a heart transplant.
Okay, so there's a process that is involved here. So when somebody's on a transplant list, then they are under the constant care, say, of a cardiologist like yourself. And would you have them on certain medical regimens like prescriptions or exercise, that kind of a thing, until that name is maybe notified on that list?
Yes, there are several medications that we would have those patients on. Those medications are geared to help maintain the heart function where it's at and prevent it from getting worse. They usually have survival benefit as well. So yes, those are required medications the patient would need to be on, and they would have to be under very close monitor and care of a cardiologist. And I will say, because transplant is so difficult to come by and there are thousands on that list, there's something else that's available when it comes to advanced heart failure therapy. There's something called LVAD. LVAD stands for left ventricular assist device. It's basically like a mechanical system that can help the patient get through that time period when they're waiting for the transplant. It is a surgery. It's a device that's surgically implanted into the heart that helps the heart pump a little bit better. So there's something called destination therapy. Destination therapy means that that patient is not going to be eligible for a heart transplant. So with LVAD treatment, they can still prolong their life a little bit, and they'll just go however long the LVAD takes them. Whereas another one is called bridge therapy, which is to get that patient a little bit longer while they're waiting on the transplant list. We can implant something like LVAD, and that can help them survive during that wait time.
My golly, what a fascinating subject matter, because when you actually get to the transplant, is it taking the heart out of the patient and then putting that new one in? How do you keep them alive? in that process while making that switch. It's not like changing a light bulb, right? It's a lot more complicated.
It's not at all. Generally what happens is there are transplant centers. Not every hospital does heart transplants, of course. And so those centers are connected with, places. All hospitals can have a donor, for example, like even a center that does not have heart transplant, they can still have a patient who could be a donor. So that part is already, like every hospital will know if a patient is a donor and that patient is in critical condition, they will be on the watch list as a donor. And so that will already be notified registry. So there is a national registry for heart transplant. So these centers, they communicate with each other and they know where there is a patient that's a possible donor that could become available soon. And so on the other side, the patient who is on the transplant list, they will be notified by their hospital and their cardiologist say, hey, your transplant may be becoming available. So they will prepare that patient for that transplant. And so say the heart, that the donor is at a different location, they could be in a different state for that matter, then they actually have private planes that they use where they'll fly the donor heart to the accepting heart, the recipient hospital. So yeah, there's a process involved for sure.
My golly. All right, very good. Doctor, thank you for talking about this. And, it is so important for the listeners out there to listen to their heart. Any issues, irregular heartbeat, checking for cholesterol. Drivers, you are your best advocate out there on the road. Nobody else is going to do this for you. That's why you got to be that best advocate for you. Dr. Fahmi Farah on the line with us. And, Doctor, before I let you go one more time, where can folks find you on the web, social media?
You can find me at www.drfahmifarah.com. You can also find me on social media at Fahmi J. Farah on X and Instagram.
All right, Doctor, thank you very much for joining us on the show. And we'll do this again next week. That is Dr. Fahmi Farah.